Welcome. My name is Becki Moore and this is today's core blast for lower back pain and disc herniations or bulging discs. During this class we use both legs as weights for our abdominals. If you have never done Pilates before and you have a lot of current back pain or irritation from a disc herniation or bulging disc, I'd recommend doing the previous class, which uses one leg at a time to begin with. If you've got some experience in Pilates and you know you're happy with holding a tabletop position without the pelvis tilting forwards or the back arching, then this class is perfect for you. If you need a block for behind your head, that makes laying down with the head on the ground more comfortable, please feel free to use one. It doesn't have to be a block, it could be a little cushion or a rolled up towel. We'll start on our backs. We'll bring our awareness to our pelvis. First of all, we want to make sure that we are in a neutral position. If you've done the previous class, you might know how to come into this very easily. That's fabulous. If you do, so index fingers and middle fingers together, place the thumbs together and bring your hands onto your pelvis. The fingertips go on the pubic bone rather than the belly. Tilt the pelvis forwards and backwards until you come to a point where you feel that your diamond shape is level. Bring your hands to your ribs, cough or laugh. You'll feel the ribs pull down. Keep the ribs there. Use your abdominals. If you like to bring your fingers to the inside of your hip bones to be aware of the engagement of your pelvic floor, please feel free to do so. Again, that's explained a little bit more in the previous class. Lift the pelvic floor, connect the hands if you wish to, bring the back of the triceps down, connect the triceps, unpeel your right foot, bring your right leg up to a tabletop position. We can gauge where our right leg should be by bringing our fingertips to our patella, to our kneecap. The tip of the middle fingertip touches the kneecap, and that's about the right distance. Everybody is different, of course, because we all have different length arms, but it is a rough idea. Now, we want to bring the other leg up to join to come to a double leg tabletop position. Slowly unpeel the left heel. Keep the eyes closed, be aware of the pelvic floor and the stability of the pelvis. Unpeel the left heel, bring the left leg to join the right. Hold for 10 breaths, breathe into the rib cage. Keep going. Notice how it feels to hold your legs using your abdominals. If you can feel it more in your back than you can in your belly, replace one foot and start again. If you can feel your hip flexors pulling on your spine, replace one foot and start again. If you can feel your pelvis tilt forwards in your back arch, replace one foot and start again. Or you could go to the previous class, which works on one leg at a time, and within time you can build up to both legs. Once you've done your 10 breaths, bring both feet down to the ground. We'll come into some modified curl-ups. Take the hands behind the head, interlace the fingers, pull the rib cage down, curl up, exhale every bit of air. Keep the pelvis level, rather than pushing the lumbar, the lower back down into the ground. Inhale, Exhale, curl up, empty the lungs. So we strengthen the core and around the spine in a neutral position. The more we empty the lungs, the more you'll notice the engagement in the abdominals. You exhale every bit of air. You'll really feel that underneath the ribs. Look at the belly or through the legs. Lower down onto the ground, release the hands. We'll come back up to a tabletop position. Right leg, keep the shoulder connected, bring the middle finger to the patella. Lift the pelvic floor, use your fingers on the inside of your hips if you need to. Float the left leg up without tilting the pelvis. We'll come into single leg stretch. Extend the right leg out, bring it back in again. Only take it as low as you can without the pelvis moving. We'll exhale as we take the leg out. Inhale through the nose, exhale out the mouth. Squeeze the quad, engage the kneecap to lift the kneecap, engage the kneecap. So we squeeze the quad, we lift the kneecap, straighten the leg. We'll go for 8 more. Keep the ribs pulled down. Notice how it feels in the belly. If you begin to feel it more in the back, don't take the legs quite as low, or maybe come back to do one leg at a time. That's also okay. Float the right leg down, the left leg down, and relax. Inhale, exhale. Inhale, exhale. Take the arms and the legs out. Come into a full body stretch. Flex the toes, pull the toes towards the knees, spread the fingers, pull the ribs down. Bring the hands back down to the side of the body, bend the knees. We'll come into scissors. If you have done the previous class, you may want to perform the exercise with the knees bent. We'll float up to tabletop position. You may wish to stay with the knees bent, hinging at the hips. Sometimes we have a little cheek and we do this, and we bend at the knee, but that's not quite what we're looking for. We want to hinge from the hips. If you want to increase it, straighten the legs, lower the right leg, bring it back up again. Lower the left leg, bring it back up again. If you want to make sure the pelvic floor is still engaged, bring the fingertips to the inside of the hips, lower and left. If we have any clicky hips, maybe don't take the legs quite as low. Keep lifting the kneecap, squeezing the quads. Keep the legs straight. Keep the pelvic floor lifted. Engage the inside thighs. Connect the back of the triceps to the ground. 4 more. Bend the knees, float the feet back down onto the ground. Extend the left leg along the mat, flex the foot, connect the hands down to the ground, bring the right leg up to the tabletop position. We'll come into one leg circle. Again, knee bent, or if you want to increase it, straighten the leg. To maintain or be aware of the stability of the pelvis, you might wish to slide your hand under the lower back. It's often a little bit easier to slide it onto the opposite side to the leg that's lifted. So lift the right leg, slide the hand under the lower back on the left side, circle for 5, 4, slow and controlled, 3, 2, keep the torso still, 1, change direction, 5, inhale as you bring the leg towards you, exhale as you take it away, change direction, last one. Then the right leg, slide the right foot along the mat. Then the left leg, come to tabletop or straighten the leg. 5 circles clockwise. Pull the ribcage down, keep the pelvis still. Flex the right foot. Point the left. You'll know if your pelvis is wibbling as well because your other leg will be wibbling. Change direction. Lower the left leg, bend the knee, bring the right leg to join it. Gaze at your knees, keep your knees really still. Press equally through your feet, equally through the back and the front. Pull the belly in, push the lower back into the ground, lift the tailbone, come up to bridge. If that doesn't feel good for you, do not do it, do not worry. You can skip this exercise if it doesn't work for you. Relax the buttocks, bring the spine down onto the ground one by one, pull the tailbone closer towards the heels. If it doesn't work for you, you can also modify the range of movement, so maybe you just lift the bottom a tiny bit and lower back down to the ground just to create some freedom in the very lower part of the back and the connection to the sacrum. Pull the belly in, lift the pelvic floor, come up as high as feels okay for you. Relax the buttocks, bring the spine down onto the ground, pull the tailbone closer towards the heels. Pull in, lift the pelvic floor, come up to bridge. Relax the buttocks, lower the spine one by one, pull the tailbone closer towards the heels, last one. Lift the pelvic floor, pull the belly in, engage the buttocks, lift up, relax the buttocks, bring the spine down onto the ground, pull the tailbone closer towards the heels. Alright, we'll take a roll onto our right hand side. In the first class, we bent the legs in our side bend. You can repeat with bent legs if that feels enough for you. If you want to increase it, you can straighten the legs. We always want the last 20% to be feeling quite challenging because that is the bit that's going to make us stronger, but it also depends on your pain levels today. So always listen to your body. This will change daily. Keep the sense of space between the ear and the shoulder. Lift the buttocks and lower for 8, 7. Flex the feet, pull the toes towards the knees. Or the legs can be bent back, that's okay. 6, 5, 4, 3, 2, 1. Hold for 5, 4, only if it feels okay for you. 2, 1. Lower the buttocks, bend the knees, bring the opposite hand, or the hand that was up in the air, down to the ground, and take the one that was on the ground up and over the head. Straighten the fingers to the corner of the room, really lengthen the obliques. We'll switch on to the second side. Knees bend if you wish. Elbow underneath the shoulder, create a sense of space between the shoulder and the ear. Straighten the legs if you did so on the other side. One side might feel quite different to the other. Lift and lower. 8, 7, flex the feet, push into the knife edge. 6, lift the hips as high as you can, or as feels okay for you. 5, 4, 3, 2, 1. Hold for 5, 4, only if it feels okay. 3, 2, 1. Lower the buttocks, bend the knees, bring the right foot over to right hand over to the feet. Take the left arm up and over, or whichever hand was on the floor. Bring it to the corner of the room. Stretch the obliques, the lateral line. We'll come onto our bellies and finish in swimming. Bring the hands onto the mat, bring the chin down, lift the right leg. Pull the right foot to the back of the mat, feel the hip creep down the mat, lift the left and lower. This is more of a lengthening exercise than it is a lifting exercise. Even though we're instructing lift the leg, it's really about creating space in between the ribs and the hips. Extend the arms out, opposite arm, opposite leg. And again, you can carry on with that for as long or as little as you wish. It's a really yummy way to lengthen the spine, particularly at the end of the day. You can really feel the increase in length in the lumbar. Thank you very much for joining me today. It was wonderful to guide you.
You can combine this class with any of the flexibility or the cool down classes for back pain, or any of the breathing and meditation classes. I look forward to seeing you again very soon. Namaste.